It takes 58 minutes of labour for low-wage earners in Malaysia to afford a litre of milk, compared to just 4 minutes in the Netherlands. That's according to a University Malaya study on food affordability in Malaysia. Here to dissect the findings is Director of the Social Wellbeing Research Centre, Professor Datuk Norma Mansor.
While Malaysia benefits from relatively low food prices due to open trade and also government subsidies, but low wages and income inequality continue to limit many households' ability to afford adequate and nutritious food. So in Malaysia, for instance, with the minimum wage in Malaysia, to afford a litre of milk, you will have to spend 58 minutes, whereas in the Netherlands, 4 minutes. For a kg of banana, you will have to spend 47 minutes working with your minimum wage. And in Germany, 5 minutes. Whereas for chicken, 130 minutes in Malaysia and 28 minutes in Australia. So it is not, I know that the critics out there, when they look at our work, the criticism is that our prices are low. Definitely, we have benefited from the open market, open trade, and also the subsidies and price control, that the prices are low. But on the other hand, for the 30% of the workforce that is in the low wage group, the issue of affordability is problematic or is of concern here.
Norma highlights Malaysia's low minimum wage compared to other countries, with many earning below 2/3 of the median wage. She proposes the setting up of a social protection floor and wage increases to improve food affordability in the country.
Number one is establishing the social protection floor, which can provide income security at critical stages of vulnerability, which would include children, the elderly, and person with disabilities. Yeah. So providing cash assistance, especially in order to face the increasing prices, food prices, will be one way the one intervention that can come in to support the Malaysians household. And secondly is the food feeding programs, which can address both food affordability and also nutritional security by providing children with at least one healthy meal per day. And this would alleviate the food costs and also would improve the health outcomes and also the educational in terms of children going to school, being more attentive and all that. There are school feeding programs in Malaysia, but it's not extensive, and also the quality of food. So expanding this what you call free food, or they call it makanan tambahan, for Malaysian kids. And especially for those areas where there are many low-income earners live, will be one of the policy intervention. And thirdly is also to look at the minimum wage. So the automatic minimum wage, or also indexing to inflation, economic growth, and median wage is the way that the Minimum Wage Council, I'm in the council as well, in the Minimum Wage Council, that we can think about and consider in order for us to ensure that at least Malaysians can afford nutritious food that will bring out a lot of, will bring good health outcomes, and ensure that even when they are older, yeah, we're talking about aging society, even when they are older, they are healthier adults and not necessarily having to spend a lot on healthcare and long-term care.